Today is World Diabetes Day. It's a disease that has great prevalence in South Africa and indeed in Africa. Greg Bryant is the country manager for South Africa at Bayer Diabetes Care. He's on the line now to talk. Morning to you, Greg. Is it fair what I just said? That's the silent killer?
Good morning, David, and thank you so much for the opportunity. Yes, you are quite correct. It is a silent killer. And it's interesting that a lot of people don't know about the signs and symptoms of diabetes.
Well, tell us what they are, Greg.
Signs and symptoms, generally speaking, would be things like blurred vision, tiredness and fatigue, excessive thirst, tingling and numb hands and feet, a hunger, always hungry, and always a frequent need to pass urine. The thirst and the urination, that would be most common in the evening. So those are typical signs and symptoms, and if you were to be exhibiting some of those signs and symptoms, then it would be advisable for you to have your blood glucose tested.
Greg, it's Tumisho here. Perhaps tell us about the significance of having World Diabetes Day. Do you think that it brings a renewed awareness for this illness?
Thank you for the question. I think it definitely does bring an awareness. World Diabetes Day, 14 November, is the primary global awareness campaign of the diabetes world. And it was actually introduced in 1991 by the International Diabetes Federation, IDF, as well as the WHO. And that was in response to the alarming rise in diabetes around the world.
The remarkable thing about it, Greg, and I think this has also been highlighted by the Tim Noakes diet, and I'm sure you've been following that controversy, because Tim Noakes was saying that he has actually reversed his likely developing diabetes through his diet. I think he said that, but certainly he's made claims for the diet in preventing it. And it's a disease that, if not entirely preventable, it would be preventable, or its effects would be neutralized if it's identified early. So isn't that the key for Diabetes Day?
Yes, certainly, and that's what we try and do with Diabetes Day screening events that we host, where we try and educate the public about the signs and symptoms, where we try and give them some literature about the disease itself, and try and encourage them to get to know more about the disease should they become diagnosed.
Greg, would you say that diabetes is more prevalent among high-income earners, or is this just a generalization?
I think that, to be very honest, is a generalization, and I'll tell you why. Simply because diabetes causes can be your genetic makeup, family history, ethnicity, health, even environmental factors. So in actual fact, it's got no boundaries. It doesn't matter who you are, you can be exposed to the disease. And that's why lifestyle
expensive medication. So perhaps, enlighten us on that.
From an economics perspective, we tend to concentrate on offering a product that's readily available through retail pharmacies. The test strips that work with the device are readily available in retail, and we try and keep those prices as low as we can. But of course, if you were to be diagnosed and you were to have to start using an oral form of medication, or even having to use an insulin form of medication, naturally there would be a cost involved. But your healthcare funders are aware of the disease entity, and to that extent there is funding available. But I hear what you're saying. It can become expensive, so one has to just be conscious of costs and try and shop around to get the best value for your money.
Well, thanks to Greg Bryant. He's the country manager for South Africa at Bayer Diabetes Centre, Bayer Diabetes Care rather, and of course today World Diabetes Day.